This conference will now be recorded.
All right. So our presentation is titled Puerto Rico in Distress. Our team was made up of Sarah, Elizabeth, Dominique, and Natoya from the Chicago School of Professional Psychology. Our thesis statement read, Puerto Rico is experiencing challenges due to ongoing natural disasters, creating a lack of infrastructure. Psychologists responding to mental health crises must respond using cultural relativity and an ethical decision-making model. Our topic will explore Puerto Rico as a U.S. territory, dealing with the impact of natural disasters, including hurricanes Irma and Maria in 2017, and the earthquake that hit in January of 2020. Our team will seek to explore and define the global crisis, outline the ethical issues at play in Puerto Rico within that context, and explain and develop specific methods and interventions utilizing cultural relativity and the ethical decision-making model to address what's going on in Puerto Rico. Following on that note, Puerto Rico is a U.S. territory. As previously mentioned, there were multiple natural disasters, and the government response was overall disorganized. Puerto Rico was already dealing with broken roadways, lack of public infrastructure, and government corruption and money mismanagement. With all of that factoring in 2016, Puerto Rico's debt of $70 billion was managed by the U.S. under the PROMESA Act, which stands for Puerto Rico Oversight, Management, and Economic Stability Act. As a U.S. territory, there has been a movement for independence and more financial autonomy in Puerto Rico. In addition to the infrastructure challenges, there have been major challenges in mental health issues, creating increases in PTSD, depression, and lack of medication on the island. In a survey conducted 1 year after Maria, 1/5 of the island's residents reported needing or receiving mental health services. 13% stated they were at a new or higher dosage of their medication for treating emotional problems, as reported by the Kaiser Family Foundation 2018. Finally, the impacts on youth, disaster-related exposure, mental health concerns, education, and the breakdown of social supports are something that the island is continuing to combat and experience. As we move into the next slide, Natoya is going to further explore cultural relativity.
When it comes to cultural relativism and implementing interventions for under-resourced areas that experience natural disasters, first responders need to be aware that they should be implementing holistic methods that will assist the population psychologically, emotionally, as well as physically. It is important that first responders are bringing aid that are in alignment with the local's national identity, culture, language, and religious perspective. One such tool that was used was the National Child Traumatic Stress Network Hurricane Assessment and Referral Tool. According to Oregon and Stewart 2019, the tool was translated to Spanish and used as a self-reported assessment with the assistance of the Puerto Rico Department of Education. Solution-focused efforts were made by the people of Puerto Rico in which people became the architects of their own recovery by utilizing the skills they already possessed. On a social aspect, Diaz 2017 reported examples of this included the island mayor driving to an underpass to communicate and send runners with messages so that city businesses can maintain and be conducted, and stores and restaurants opening and operating outdoors. Integrating intercultural creative art therapy and was also successful in restoring a sense of resilience with the people of Puerto Rico. Locals sharing visual arts, paintings, and writings that have been dedicated to the island assisted with this. Martinez 2018 reported, even in the initial days after the hurricane, neighbors and families were meeting together for collective cookouts and singing the plena and playing traditional instruments. Elizabeth will now continue with ethical dilemmas.
When psychologists are having to respond under difficult situations like those created by lack of infrastructure, they are having to make the best ethical decisions they can under stressful situations. The Canadian Code of Ethics actually ranks the principles in ethics so psychologists can make the best decisions by knowing which ethical principle should be the first one to be implemented. Psychologists may also have to be working with impaired colleagues because local psychologists may be experiencing the same stressors that other residents of the island are experiencing. So psychologists just need to be aware and being mindful that their colleagues are experiencing those stressors. People coming to the island to be responding may be bringing their own cultural relativism with them, and psychologists may be needing to step into that leadership role and providing coaching. Some of the inequities that are occurring may be leading to poor outcomes, and so psychologists need to be documenting those poor outcomes. One of the ways to resolve the culture or the ethical dilemmas that are occurring is consultation with colleagues, so that some of the best thinking is going into making those decisions, collaboration with those colleagues, deciding what to implement at the beginning of the day, and then having debriefings at the end of the day to see how well those decisions worked, to see if there's anything that they can be doing better, and then implementing those better way of doing things the next morning, and then again debriefing that night to see if there's any improvements that need to be made. And then if all of this creates learning that can be applied at the next time there's a disaster response. And so bringing back that learning and also bringing back the information learned about the inequities and the poor outcomes, so that that information is shared and hopefully those inequities are resolved so that they're not continuing. And now Sarah is going to help us summarize what we learned in through this presentation.
Thank you, Elizabeth. So as we mentioned, Puerto Rico is a U.S. territory that has suffered from multiple natural disasters in the last few years, or in the last 10 years or so. Hurricane Irma, Hurricane Maria, the earthquake recently. The U.S. government response was not organized, which contributed to the existing mental and physical health symptoms of the Puerto Ricans. It lacked resources for them that they desperately needed, including medication, threat to food, that they had to just turn to each other as a community to provide limited resources to each other, which they already did not have. So going in, any first responders that are going in or any IPs that are going in need to be aware that the local IPs that are working there may be hurting themselves, so providing relief to them, as well as be aware of the local cultural dynamics and cultural needs. So factoring in the cultural part and the psychological, spiritual, emotional, and the physical needs of the area. The ethical dilemmas, as mentioned previously, there may be a breach of ethical dilemma, so the IP will need to go into the order of what is needed and the most important, and additional training may be needed to avoid ethical dilemmas that may occur. There is going to be a need for detailed documentation because of the existing or the lack of existing resources. So making sure that everything is being done that can be done, as well as regular debriefings, will help to overcome challenges that are not anticipated, to help the colleagues learn from each other and to avoid any and all further causing any kind of pain to the Puerto Ricans. So that's it. And
references are going to be at the end of this presentation.